The David Pakman Show at davidpakman.com.
All right, before we get started, a couple of notes, Louis, if I may. Number one, Monday, we will be joined by former Minnesota Governor Jesse Ventura. If you have questions that you would like me to ask Jesse Ventura, here's the key part. Email them to us, davidpakman.com. Click on Contact Us. Email us the questions. And number two, it's getting really hot outside. It's like kind of summer here, kind of. I don't know. It will be soon. Tomorrow it's going to be 90. And in a lot of the country, it is getting very warm. So why don't we give away some free T-shirts with membership? davidpakman.com/summer13, summer13. That's pretty straightforward. Get a 1-year membership. We'll send you a free T-shirt. We'll even ship it for free if you live within the U.S. Very, very easy.
I like it.
I like it too. So a few weeks ago, we discussed how the influence of Obamacare was already lowering health insurance premiums in several states. In fact, I told the really specific story of, I don't remember if it was Washington State or Oregon, where after seeing the initial proposals for monthly premiums, a couple of insurers said, oh, you know what? We're too high. We're going to have to revise our prices lower to actually compete. We talked about that weeks ago. We now have an article in the Washington Post Wonk book, which points out that there is negative pressure on prices, but also it turns out that Obamacare is going to be even cheaper than the Congressional Budget Office estimated. So initially we had these estimates from the CBO, and Republicans were saying they're way off, they're biased, they are flat out wrong, even though historically the Republicans have actually pointed to budgets from the CBO when they wanted to make a case for something. That obvious hypocrisy aside, it turns out, for example, that the nonpartisan CBO predicted that in California, the monthly insurance rates under Obamacare would run around $450 per month for medium level, what's called silver level insurance, okay? Reality is showing that the medium level plan in California is going to cost around $294 per month, and this is before subsidies. Remember that depending on how much you make, you don't have to pay that full rate. If you're making, for example, twice the poverty line, your rate would be $104 per month. This is not affecting, this logic, this reality is not getting to a lot of the conservative states, which are doing everything possible to sabotage, I almost sound like William Shatner, to sabotage. You've heard that thing.
Sabotage?
Sabotage.
Yeah.
To sabotage Obamacare. They are saying we're not going to do it. They are saying, I don't care if we actually have to pay into it. We're still not going to do it. We're hearing all sorts of nonsense from a lot of these red states, but it's becoming very, very clear that in the blue states that are actually realizing that this is a good idea, the numbers are even better than the CBO predicted. You surprised?
No, I guess not.
What's going to happen with healthcare in this country, right? I mean, we have the resources. We have smart people. We have a system where we're already paying for the uninsured who use the emergency room as their health insurance. Why can't we just get past people like Rick Perry, the Republican Texas governor, who's done everything possible to deny health coverage for millions of poor people who live in Texas? Why can't we just push that aside and do something really good, Natan?
Well, they're trying to not allow it to happen, but it will happen. You're already seeing a lot of states. We've already talked about it. John Kasich in Ohio, a number of other governors in red states have accepted the Medicaid expansion. In Arkansas, they're doing this other program where instead of expanding Medicaid, they're going to have the federal government pay for private insurance for the people that would have been eligible for the Medicaid expansion. So in a few years, it's not going to be politically viable to be against it. And when that happens, the full effect of the law will really be seen.
Do you agree with that, Louis? Once the benefits of Obamacare are seen, there will be really a lot of momentum to actually go and do something that goes even further than the Affordable Care Act?
I hope so. It depends on how many people are still hell-bent on repealing it and spreading all sorts of misinformation.
Right.